Hello and welcome to the show. We continue our discussion on the importance of the HIV Workplace Advocacy Unit, which is a unit under the Ministry of Labour. In this episode, we are speaking with organizations to find out how they have benefited from partnering with the unit. So, joining me are Michelle Ramessar. She is the Human Resource Officer at the CEPEP Company Limited, and Cindy Wilson, the Director for Advocacy for HRMATT. So, thank you for joining us, ladies.
Thank you for having us.
So, we're going to start with you, Michelle. Tell us a little bit about CEPEP and your role at CEPEP.
So the CEPEP, we're the Community-Based Environmental Protection and Enhancement Program. We are an agency of the Ministry of Rural and Local Government. We implement, develop, and manage programs which are geared towards enhancing and beautifying the environment in service areas known as environmental work areas.
Okay. And Cindy.
Our association's mandate is really about promoting the HR profession, supporting leaders as they, execute HR people-related functions, and we carry a number of programs and initiatives, towards that effort. We also advocate for fair labor standards and practices within the workspace. So, partnering with this unit was of particular importance to us as we carry out our initiatives.
Now, Michelle, what was the major motivation for CEPEP to partner with the HIV Workplace Advocacy Unit?
Okay, so in 2021, the HIV Advocacy Unit would have reached out to our then senior HRO to engage in discussions on our existing HIV workplace policy. So they would have reached out wanting to review the policy to ensure that all the principles were captured. Of course, as an organization, we were eager to collaborate because, of course, it meant us advocating for the care and support of our employees. We wanted to promote a healthier, safer work environment. And as such, that collaboration ensured that we are
in compliance,
correct.
Essentially.
Yes.
Okay. And was it the same at your organization, Cindy?
For HRMATT, we're on the other side of the spectrum as an association representing human resource professionals. We were approached to assist with the, or at least give some feedback in terms of the framework that was being developed. And again, as I indicated, part of our responsibility, we see it as advocating for fair labor practices. So understanding that HIV and AIDS are workplace issues and needing proactive interventions, we thought it would have been necessary for us to partner with the unit so that we can have our members educated, and within their organizations they can as well partner with the unit to build programs that would support their employees who may be experiencing HIV and AIDS in their lives, and what that means for their workplaces as well.
Okay. So did you know about the unit before the initial engagement?
Actually, personally, no. I was not necessarily aware of the unit. As I became more involved in HRMATT itself, I understood the good work that was being done in raising awareness for the advocacy for HIV and AIDS in the workplace. And however, through the partnership, I would say that I've personally gained a lot more insight as to what these issues are and how we can proactively work together to address them.
Okay. And Michelle, did you consider HIV and AIDS, that conversation to be an issue within your organization and for your members of staff before the engagement with the unit?
Yes, definitely, because as I mentioned, we had a policy in place before, so we are aware of the workplace issues surrounding HIV and AIDS. Of course, we understand the importance of care and support, dispelling myths that surround the whole issue in terms of employees feeling safeguarded by our policies. so that they don't fear discrimination, and if they are discriminated in the workplace, they know that we have policies in place to safeguard them.
Okay, so how difficult or easy was it for your organization to develop a workplace policy?
Okay, so I was not really involved in the initial stages of the development of the policy. I've been more involved with the development of the program, and so I can speak on that. Um, we've had a great experience thus far. The HIV Advocacy Unit has been extremely beneficial and crucial in us developing that program. We've had the support of our management. Because of course, we have to get the necessary approvals as an organization. And while we were developing the program, we've been initiating activities to engage staff. And as such, we've always had the support of our staff, of our management. So it's been a great experience thus far.
Has staff been receptive to all the program initiatives?
They have. We've had a great turnout. We've conducted health fairs, in-house sensitization sessions. We've did Pool Observation Day, and all of that. We've asked them to come in, and we've had one-on-one interactions, of course, with the help of the unit, the HIV unit, and staff have been very receptive to that information.
And what about you, Cindy, on your end? I know you're not dealing directly, with the staff of your organizations, but how has that process been in possibly helping your organizations in development of the plan?
I think, working with the advocacy unit has been really transformative. I think it's really about opening up the discussion. Dialogue is absolutely needed. If we're not able to talk about an issue, then we're not able to adequately address an issue. And what the unit has been able to do for us is bring the membership together, create spaces for education and discussion so we can dispel some of those myths that are around. And the conversations, I think, bring a certain different level of awareness that puts us in a space to be able to more holistically address an issue that is a very pressing issue and continues to be one, for the country.
We'll take a quick break and come back with more. Stay with us. Thank you for staying with us. We are continuing the conversation with Michelle Ramessar. She is the Human Resource Officer at the CEPEP Company Limited, and Cindy Wilson, the Director for Advocacy for HRMATT. How has the feedback been with your organizations?
I think that the organizations have been very receptive whenever we do have sessions, and I'd like to see us have more regular sessions. There is a lot of heavy participation. There's a lot of dialogue. When we did the feedback for the framework, we did a session with the members. It was supposed to last about an hour, and it went on and on and on. We could have spoken and debated on the issue for a very lengthy period of time, and we had to cut it. So that tells me that people are open to having the conversation and are open to being a part of addressing the issue.
Was it very difficult to implement any of the program initiatives with your organizations?
I can't speak to the experiences of the organizations themselves, but HRMATT is always available to provide support to the membership, and through the advocacy unit in itself, we continue to try to provide resources and structured programs for organizations who are willing to, take that step to really proactively address the issue.
Michelle, what do you think would be your suggestions for the enhancement of the programs for it to be, I guess, more effective to your members of staff?
So, as I said, the unit has been extremely helpful. So we've always had their support and guidance. So in us drafting our program, they've provided us with a guide so that we ensure that what we do, the activities we want to implement are realistic, results-oriented, measurable. We want to ensure that it's financially friendly so that we can actually execute to see results.
So, Michelle, how can you see the partnership between your organization and the HIV Workplace Advocacy Unit expanding or progressing further?
I can see the partnership developing further in terms of the wider need to guide the contractors to, I'll recommend them to have policies in place, HIV policies in place to safeguard their workers. We, as the organization, can act as the liaison between the Ministry of Labour, HIV Advocacy Unit, and the contractor, so that we could guide them, and as I said, provide the necessary guidelines needed. Also, because of the fact that we now have a program, there will always be the need to liaise with the unit to get access to the resources, and in terms of them coming and providing the support and assistance needed to conduct the sensitization sessions and to even provide testing for staff. So we could definitely see the partnership being developed further.
And you, Cindy, how can you see the relationship between your organization and, the organizations under your organization and the partnership with the unit progressing further?
I think our vision for this partnership is really, seeing more regular workshops, sensitization workshops for the members, education for HR professionals on how to address some of these issues that may arise in the workspace, updated policies as the landscape continues to evolve, because, as different generations mature out of the workplace, different issues and different angles to address the issues may arise as well. And I think that HRMATT would be really interested in working directly with the unit to forward research on how we can actually, assess the impact of HIV and AIDS in the workplace, as well as, look at the policies that are being implemented and the impact that they're actually having on organizations. Further, one issue came up in our discussions as a membership in terms of the insurability of persons with HIV/AIDS in the workplace and organizations being able to provide that benefit to their employees. And I think that as we continue to work with the unit, that is something that we can explore a little bit more deeply and try to find some solutions to inviting other stakeholders, for instance, the insurance companies and so forth, into the discussion, so that we can ensure that there's that care and support really, and persons are not missing out on valuable resources like benefits, medical benefits, etc., because of their HIV status. Additionally, I think what might be beneficial is the implementation of a space where organizations can share best practices and learn from each other's experiences. And I think HRMATT bringing together HR professionals, it can provide that platform to the unit.
So tell persons or persons within organizations, why do you think that having a policy, having these program initiatives is helpful to the members of staff in their organizations?
I think sometimes, we need to speak the language of organizations as well. Connecting the issue and the policy for HIV and AIDS in the workplace to larger organizational goals like inclusivity, diversity, and inclusion, etc., I think is very important that we're able to tie those so that organizations understand that it's not only a moral obligation that we have, but also a business imperative. I think, that creates more buy-in for organizations. I mean, companies are in business to make money, and therefore we need to understand that, these issues affect not only employee well-being, but as well, productivity within organizations if we don't adequately address the issue. And So I think that organizations should consider this as an opportunity to, build a culture of inclusivity, a culture of care and support that creates trust and productivity within the organizations.
I would like to thank you, Cindy and Michelle, for joining us on this episode. And I know that you're going to go back and continue to implement the good work, in partnership with the unit.
Thank you.
Thank you. Thank you for having us.
So, from the entire TTT News crew, thank you for joining us.